Cheese. Alright, no, we're not going to talk about teeth. They're not even bones. They look like bones. We'll talk about them later in the digestive system. But how often do you get a chance to look at the difference between teeth with no braces and the after with braces? Not very often, right? So there you go. Before, after. No, these are not my teeth. Unlike many of you, I am perfect in every single way. Of course, that's a joke. So here you go. Before and after, braces. Let's move on. Skeletal system. Here are a couple of maybe useful x-rays. Two things that probably happen more common than you might think. Severe head wounds from being penetrated by, in this case, a spearfishing spear or arrow. And supposedly this person survived. And then this one here you can see is a sideways picture of the hips. And yes, those are scissors, surgical scissors, which actually also occurs more often than you might think. Instruments getting left behind. Part of the surgery is making sure that everything is taken out, and there are strict counts of all instruments used before, during, and after a surgery to prevent this. Alright, so skeletal system. Now we're going to talk about bone functions, and that's the one of the big purposes of this unit. You can see here muscle attachment, producing blood, and other things that we'll go through. But first, before we get to bone function, we're going to talk about structure. And again, this is anatomy and physiology, so we're going to cover structure and function. Alright, so you can see here, this is a femur, which is the long bone, the longest bone of your body. This is the upper leg or thigh bone, and typically used because it is nice and long and a good model of long bone structure. At the ends, top and bottom, you have the epiphysis, or epiphyses if it's plural. They are circled here in purple. They're the top and bottom. Epi just means above or on, and PHYS refers to, boy, I can't remember. PHYS. It's not a process. Just a second. PHYS is gas or air. You will see when we get to the structure of these guys is that there's a lot of space in here. Space for gas and other things. Which, by the way, there's the website that I just looked at is a link to our haiku page. It's the prefix and suffix page, medical prefix and suffix page, which is pretty helpful. So anyways, the ends of the bones are going to articulate or join with other bones to make joints and cause your skeleton to move. And you can see on the ends there, at least on the bottom, it's covered in cartilage, type of cartilage that we've seen before. But in this case, since it's at a joint, we're also going to call it articular cartilage. In the middle of the bone, or the long shaft of the bone, is called the diaphysis, and that is where a lot of things are taking place, and this is most of the bone. And so, again, we'll talk about all these things in just a little bit. Somehow skipping letter C, going straight to D, not sure what happened, is the periosteum. Peri just refers to the surrounding parts, and in this case it's OSTE, which is referring to bone, and UM just refers to tissue, so it's the surrounding bone tissue, so it's the outer layer of bone. And it's actually also very useful because it's connecting tendons and ligaments. In other words, it's connecting bone to bone and muscle to bone. Continuing bone structure, we have the diaphyseal wall, which is made of compact bone, and that's what you're going to see on the inside, the shaft of a long bone. It's very dense. It has no spaces, which is the opposite of what we're seeing at the ends, particularly right here. It's purple circle, also known as spongy bone or cancellous bone. It's very lightweight because you can see here there are spaces here, air spaces. Those holes are called trabeculae, and they give it kind of like this honeycomb look. We'll see the significance or importance of this in a little bit. Alright, so again, back to the diaphysis. This is compact bone, which is surrounding a cavity called the medullary cavity. The lining of this cavity is endosteum cells. And again, endo or end just means the inner, and again, oste is referring to bone, and um is tissue, so just the inner bone tissue. And again, you can kind of see here this is filled with yellow marrow, and we'll see what that's all about just a little bit. So here's another picture, pretty good picture, showing you kind of all the main parts of a long bone. Alright, as far as microscopic bone structure goes, we've kind of already started talking about this when we started talking about tissues. Bones are made by osteocytes, which are the cells that create more bone. We've seen this before, cytes, just like in chondrocytes, for making more cartilage. And these osteocytes are actually located in little spaces called lacunae. And lacunae are surrounding haversian canals or central canals, which you can see here is a central canal. These rings are called lamellae, kind of like tree rings. And they are just rings of bone matrix. Bone matrix is up here the non-living part of a bone, which is just providing the structure for the skeleton. One individual unit of all these rings with the central canals and all the other parts is called an osteon. And within here you can see there are other things going on. A lacuna, or the lacunae, are multiple little cavities. And in these cavities are where the osteocytes actually are found. The bone cells, or cells that are making more bone, are found. Between lacunae are like little tubes, little passageways called canaliculi. And these are just for communication and nutrient exchange between osteocytes. So a lot of stuff at the microscopic bone structure level. Some of them we've already talked about, and also some new ones. Let's talk more about canals in just a little bit. Here's a little bit better picture. Oops, sorry, coming up on the next slide. The two main canals we'll talk about, haversian canals. These are the big central canals that contain blood vessels and nerves that go, if you're looking at like a femur, it's going up and down, running the length of the bone. And the osteon, which is the unit, one individual unit of bone, is each osteon are connected by Volkmann's canals, or perforating canals. And again, these canals are just for communication between central canals and medullary cavity, which again is the inside, the very inside of the bone shaft. And these are running horizontally across the bone, so more like a transverse direction. And here's the picture I was talking about. So again, all the parts. Here's one individual unit, an osteon. You can see it's just kind of like a circular unit. Within that unit are these lacunae, which are the little cavities, teeny tiny cavities that you can really not even see on here, besides little dots. And that's where the osteocytes are found. Here's a blown up picture. Here's lacunae with osteocyte inside, or lacuna. And then again, the canaliculi, which are the little tubes that kind of go in between. And the haversian canal, which is the main tube, central canal, where blood vessels and nerves are passing through. You can see here some spongy bone. So this is the outer, or the edge of the bone shaft. Again, the haversian canal. Haversian canals are going lengthwise through the bone, and the Volkmann's canals are going across the bone. You can see both carrying blood supply, nerves, nutrients, and these blood vessels. So here's a little pop quiz for you. The holes where bone cells live, kind of a slang question. And 2, the things that contain blood vessels and nerves. And the part of the bone that's non-living is number 3. which part contains the red bone marrow and which part contains the yellow bone marrow. They are very different spots. So take a second and pause and see if you can come up with these answers on your own. Alright, here are the answers. And since you've already seen them, I've explained them already, we're moving on. Alright, so talking about bone development and growth, this is obviously stuff we're talking about in vitro, or I should say in the womb. Formation occurs during prenatal development, so we're talking about very, very early on in human development and mammal development, but let's just focus on humans. The process of creating bone from cartilage is called ossification. An ossicle is actually a very small bone, so you can see where that comes from. And there are two types of bones that form: intramembranous bones, and these are the ones that are making up like the skull and the hip, very flat bones, and endochondral bones, which are the ones that are actually forming from cartilage, and those are most of your bones that we talk about. So first, the intramembranous bones. These again are the broad, flat bones, like the skull, bones in the skull, hip, sternum, which is your chest. So here are these steps. Pretty simple. It's just going to start with sheets of connective tissue, and we've already talked about connective tissue, so you have a pretty good idea what that is. But then these osteoblasts, which are something we haven't talked much about. And these are just bone creators, or maybe bone builders would be a better way to remember this, because of the B, builders, which are going to lay down spongy bone around themselves and just continue. And then eventually compact bone forms around the spongy bone. And eventually osteoblasts become osteocytes when they are surrounded by bone matrix, which is just kind of the dead tissue. Full of a lot of calcium. And then chondrocytes, which are the cartilage forming cells, are forming along the outside of the bone, which again is the periosteum. So peri is the surrounding, oste is the bone, and um refers to the tissue. So the chondrocytes are creating this periosteum, the outer bone layer. For endochondral bone formation, it's a pretty different process. And again, we're talking about most of the bones in your body in this case for endochondral bone formation. And we'll take a look at this picture again at the end. But just in general, it starts off with cartilage. Kind of starts in the middle and at the edges where the growth starts. And then they just keep growing until one growth edge meets another growth edge. And you have a complete bone with just cartilage on the outside, which is going to be used for joints and stuff that we'll get to. So endochondral bone formation, here we go. Again, starts with cartilage, hyaline cartilage, and the chondrocytes in the center just kind of die and create the space for osteoblasts to come in and begin forming the diaphysis, which is again the shaft of the bone, a long bone. The shaft of the bone is, in this case where the bone is forming, it's called the primary ossification center. This is where most of the bone tissue is being made. And this is different because there are no ossification centers in intramembranous bone formation. Continuing, these osteoblasts, again, these are the builders. Blasts are builders. They're going to continue forming and laying down compact bone underneath the outer layer. Again, periosteum is the outer bone layer. And so the bone grows from the inside out, basically, just like we've talked about with skin, same idea. Secondary ossification centers are found at the edges, and again, those are the epiphyses. The epiphyseal plate is made of cartilage and forms between the two ossification centers, and eventually those two ossification centers will meet and become just one entire bone. Here's another picture that's actually from an animation that we'll probably take a look at in class. And this is just, again, the edge of the bone, the epiphysis, and here's the shaft of the bone disappearing into Nowheresville. There's the diaphysis. Eventually those two meet, and form one continuous bone. Here's the microscope picture. So finishing up with endochondral bone formation, a few more steps. These plates at the edges produce cartilage that keep the bone growing until the bone is fully grown, which is not until for most bones into your 20s when your bone is fully grown or finished growing. Osteoclasts are the other bone cells that we need to talk about. Osteoclasts are breaking stuff down or cleaning up, if you want to think of it this way, as the CL. They're kind of cleaning up the mess. So they're going to break down cartilage or kind of clean up the cartilage. I guess you can think of it that way in the outer plates. And actually they're secreting hydrochloric acid, and we will take a look at how, or have, depending on when you watch this, how acid affects bones, bone density. And what's happening here is the products that are being broken down, namely calcium, are going to go somewhere else to make more bone. Alright, almost done. In endochondral bone formation, these osteoblasts are going to continue to build bone outward from the ossification centers. Again, kind of like inside-out mentality process, just like skin that we already have seen. And then eventually, when these two ossification centers meet, meaning the shaft and the edge, it's going to create one solid bone, and there's no more bone growth. And again, this doesn't happen until perhaps your mid or maybe even late 20s. Alright, we're going to finish with a true-false. If it is true, then just say true. If it's false, you should know what's false about it. So here you go. Take a second to read. And pause when you are finished. And here are the answers. And that is part one of the notes.